our last session of our event, and I would like to start by informing that unfortunately Kirsten de Mello is not going to be able to participate due to some health concerns, but we wish her a speedy recovery. Our next speaker is Dr. William Moore. Dr. Moore is a naturopathic and chiropractic physician in private practice in Vancouver, Washington, where she volunteers as a court-appointed special advocate for children in the foster care system. She teaches nonviolent communication classes to those in and out of prison and is an equine facilitated learning instructor. She has served on the board for Therapeutic Alternatives of Maryland, an organization combining traditional therapy with equine, horticulture, and alternative treatments for physically and mentally challenged children. She's also on the board of directors of the National College of Natural Medicine. Please welcome Dr. Moore.
That one.
And that's the light.
Okay. Hello. Thank you for coming back from break. So the title of my talk actually is Recognizing the Spirit in the Human Being. And as with many of the previous speakers, Dr. Doi selected that title for me. So when I saw it, I asked myself, when did I first notice that I was recognizing spirit? And I realized that I've always acknowledged and based my life choices on what Dr. Schwartz says is spirit's collaboration with us in our daily lives. So I'm a naturopathic doctor, and I'm going to talk to you about naturopathic doctors and how we recognize spirit in our patients. So has anybody heard of naturopathic doctors? Just raise your hand. Excellent. Anybody actually had a visit with a naturopathic doctor? Oh, good. How many of you refer patients or friends to naturopathic doctors? Excellent. So naturopathic medicine is based on vitalism, which I think Dr. Nobra mentioned. It was kind of the holdout for vitalism. And it's a very eclectic way of practicing. We utilize any appropriate therapy that's going to be helpful to our patients that follows and conforms with the principles of naturopathic medicine. And I'm going to talk about those principles. So this is the garden at the school, National College of Natural Medicine. They're doing Qigong in the labyrinth at this garden. And NCNM was established in 1956. It's the oldest accredited naturopathic medicine college in North America. There are others. There's one in Arizona called Southwest. There's Bastyr up in Washington State in Seattle. And then there's one at the University of Bridgeport in Connecticut. There's also two Canadian colleges, John Boucher, which is in BC, Canada, and the Canadian College of Naturopathic Medicine, which I believe is in Toronto. I should know that. About 50% of the licensed naturopathic physicians that are practicing now in the United States are graduates of NCNM, including the doctors that started the other colleges. So at our school, we give out a number of different kinds of degrees, and that's why we're called the Natural College, or the National College of Natural Medicine. We used to be called the National College of Naturopathic Medicine. So we do a doctorate, a Doctor of Naturopathic Medicine. We do a Master's of Oriental Medicine, and we just added a doctorate tract for that. We do a Master of Science in Integrative Research, and we're doing some really interesting research there at the school with natural treatments. We also have a Master of Science in Nutrition and a Master of Science in Global Health. We are about to add a bachelor's tract. so that we can have people come into the school, take whatever they might need to know before they enter the naturopathic medicine doctor program or the Oriental medicine program. At that point, I believe, according to state law, we're going to be called a university, which is pretty exciting for us. It is very cool. This is an accredited 4-year graduate medical program. We get primary care clinical training. Licensure requires a 2-part national board exam, and we are licensed in 17 states, plus a registration in District of Columbia and the 2 U.S. territories. We have continuing education requirements. Fortunately, a lot of the talks here are going to help me with mine, so I'm appreciative of that. Our current licensure is all of these places. And I want you to notice that Maryland is there. That's the most recently licensed state. That was this year. So the scope of practice, what the naturopaths can do, varies state to state. It depends on how the law went through. For example, in Oregon and Washington, we have full prescription rights, including Class 3 narcotic drugs. We don't tend to use them as much because we favor other ways of treating people. And it's very helpful, though, when we need to wean somebody off of a medication, because you wouldn't want to do that if you weren't the prescribing doc unless you knew how to address it. So almost every state has botanical medicine, clinical nutrition, homeopathy, hydrotherapy, lifestyle counseling, mind-body medicine work. Some of the states allow minor surgery, some allow midwifery, some allow physical medicine, which includes manipulation, and they vary in degrees, allow various pharmacology applications, and some states allow IV therapy. So the two states that I'm licensed in, which is Oregon and Washington, both allow IV therapy, but you have to have an additional 50 hours of training and continued education. So the principles of naturopathic medicine. The first one is the one that I think resonates the most with my beliefs in spirit. And that is vis medicatrix naturae, the healing power of nature. This basically means that we completely understand that we don't do the healing, that spirit does the healing. And spirit heals through these bodies of our patients, and perhaps through us. So we understand that there's an inherent self-healing process in people that is ordered and intelligent. We act to identify and remove obstacles to healing and recovery, and to facilitate and augment this inherent self-healing process. Some of those obstacles to cure might be a vitamin deficiency. It might be a toxic exposure, like somebody was exposed to lead or arsenic. It can also be a little bit different. It could be, and we do consider this, a more complex situation involving the laws of action and reaction. So multiple embodiment difficulties, or something that's been carried down through embodiments, or a miasm, what we call a miasm, which is a mental, emotional picture that can move from generation to generation. And I'll be very curious. Actually, now I have a question for you. What would we call that with respect to Spiritism? You still call it a miasm? Oh, excellent. Excellent. Principle number 2, identify and treat the cause. So we really try to find out the underlying cause of an illness rather than merely eliminating or suppressing symptoms. And oftentimes those symptoms are very helpful for us to figure out what the cause is. There have been cases where you might treat someone and the symptoms change. You treat the new symptoms and the symptoms go back, and then you kind of have this situation where you get to choose which symptoms you want. to have for the patient, right? And all naturopathic doctors use some kind of energetic medicine, either homeopathy, acupuncture, or botanical medicine. Principle number 3, first do no harm. So we like to utilize methods and medicinal substances which minimize the risk of harmful side effects and use the least force needed to diagnose and to treat. We like to avoid, when possible, harmful suppression of symptoms, and we acknowledge, respect, and work with individual self-healing processes. So when we are considering using new treatment modalities and methods as a group, we would be considering that it fits under this do no harm principle. And since its inception, naturopathic medicine kind of came together in the late 1800s, early 1900s, in New York, actually, at a big conference. And it kind of put together the physicians at the time who had been practicing nature cure, which is utilizing sleep, rest, getting outside in nature, good eating, right, appropriate eating, and homeopathy. Are any of you familiar with homeopathy? Great. Lots of people. And actually, of course, at that time, probably most physicians used botanical medicine. And homeopathy was pretty widespread also. Number 4, we use the doctor as teacher. We educate our patients, and we encourage them to be responsible for their health. And we also recognize and employ the therapeutic potential of the doctor-patient relationship, sometimes known as the placebo effect. Principle number 5, we treat the whole person. We take into account individual physical, mental, emotional, genetic, environmental, social, and other factors. Since total health also includes spiritual health, we encourage individuals to pursue their personal spiritual development. I frequently myself recommend meditation. Just 10 minutes. You can just sit 10 minutes and just let thoughts go in, go out. It gives you a break, right, from the rest of the day. But I know you all know this. We see health, as Dr. Pert said, as a bio, psychosocial, and spiritual welfare. And number 6, prevention. We emphasize prevention of disease by assessing risk factors, heredity, susceptibility to disease, and make appropriate interventions in partnership with our patients. We do this because it's always much easier to prevent something than to try to catch up and deal with it later. The energetic medicine that I utilize the most is homeopathy, and I know you're familiar with that. That's when you use a small dose of a substance to trigger the body's own self-righting mechanisms and healing mechanisms. Homeopathy works on the physical, emotional, and mental levels. And I believe the founder of homeopathy, Samuel Hahnemann, is listed as one of the doctors that talks through a number of psychographed works, as I recall. I can't remember which one in particular of Chico Xavier's, but he was mentioned in there as talking. Do you know? Does anybody know? Nope. So Samuel Hahnemann developed homeopathy in the late 1700s because he was really unhappy with the way medical practice was being done, where the cure was oftentimes worse than the disease. And he wanted to have some type of a treatment program that would be able to help a body correct itself, and if it didn't work, then it really didn't have an effect. And so he started studying and realized that there were 3 principles that I believe in early medicine were talked about. And the first one was do nothing, which lots of us do when we get sick, right? The second one was to use something that was going to reverse the symptoms of the illness, which we're also used to. So you will take a medication to bring a fever down when you have a fever, right? Or you will take a medication to bring blood pressure down when you have high blood pressure. And there's a third one, which is where you use the same thing that will cause the symptom in a large dose, and it will cure it in a small dose. And this is homeopathy. So you would use a medication that could cause high blood pressure if taken in a large amount, but in a small amount, in a minuscule amount, it will remind the body that there's an imbalance there and let the body's own natural healing mechanisms take over. So the homeopathic principles include that all life has a direction and that there is an underlying unity to all things. And I just want to mention the very opening slideshow. Whoever put that together, when they talked about potent medicine slides, those were all homeopathic remedies that they had on that slide. So thank you for putting that together. So homeopathy, remember, was introduced in the late 1700s. And it had already this concept that energy gives rise to the biophysical realm, which gives rise to the biochemical aspects, giving rise to the physiology, which gives rise to the anatomy. So our students now that come to the school have retreats at the beginning of every school year, where they go out for a weekend for revitalization of the medicine, they call it. And these retreats have some of the elders come and talk about the spirit of naturopathic medicine, the history of naturopathic medicine. And they also have an opportunity to experience themselves the healing that can occur from various therapies like mud baths and massages and hydrotherapy protocols, yoga, qigong, meditation. And I just went and talked at one of those a few weeks ago for Bastyr. And it was so heartening for me to see so many potential new docs coming out still holding and valuing the spirit of this medicine and basically that the body will heal if you can just give it a chance to do so. They talked about a new phrase that I hadn't heard before, and I just thought, this is it. We are the medicine. Now that can mean a number of things. It can mean we as the doctors are the medicine, because this was a lot of naturopathic students that were talking, right? Meaning they embody the naturopathic medicine, they live the principles, they are that medicine. It can mean we, all of us, can be that medicine. And I know that this group in particular knows that and is working on that, because that's what allows light to come into our bodies and be held more and more by ourselves. So the more we can do that, the more medicinal value we have to every place we go. And now that's what I start to think of my biggest work, is to help people become clearer and able to be the medicine in their own lives, in their own families, in their community, wherever they go, in their workplace. And that is kind of where my practice has gone. I've been in practice for 30 years or so. And I started out thinking that I was going to prescribe a medicine for a particular ailment, maybe do a lifestyle change, get people healthy. This was going to be great. And very early on in my practice, I realized that our environment and the way we live now was presenting the biggest obstacles to cure, with the toxicity levels that are just everywhere in our environment, as we all are aware of. And that I had to do something different. And so that was to encourage people to detoxify. And I did that on a number of levels. You can use homeopathic remedies to detoxify, you can use physical means, you can go on fasts and cleansing programs, you can do sweats, you can do IV treatments. I mean, I would just model whatever programs people needed for whatever their particular situation was. And now, as you heard in my introduction, I have moved from detoxifying to helping people adjust how they think about themselves, the world, what words come out of their mouth on a daily basis, so that they can be the medicine. And I do that with nonviolent communication classes, with working with horses who are extremely good at being frightened by the impending attack from the lion and running and then stopping and going back to grazing. And then they don't stay up all night worrying about why God invented lions and when the next one is going to jump out at them, right? And they don't get traumatized from it. They just are in the present moment and they can go back to grazing. Which to me also means letting things flow the way they're supposed to in these forms. So the horses also help with teaching people to use our bodies, this part of us, as a sensing device, which it is designed, as we've heard on these lectures in the past 2 days. This is what our bodies are designed to do. And the question is, how do you help people become more in tune with what their body is telling them, so that they can hear the messages their body says, so that they can then make a response, adjust their lives, and be healthier. So that's what I'm busy doing. I think that's all for this presentation part. Quick.
We will now have a roundtable discussion with Dr. Moore, who will be joined by Dr. Claudio Petrillo. Please come on stage. This will be followed then by a Q&A session for the audience to participate in and for their questions. Dr. Claudio Petrillo is a physiatrist who has been in practice for 40 years in Norwalk, Connecticut. He was trained at New York University Medical Center and has served as chair of the Department of Rehabilitation at Norwalk Hospital for 30 years. He has, Dr. Petrillo has psychographed 7 books in the past 8 years, and these books are available at the book table out there, and he will make himself available for signing afterwards, okay? So please, go ahead.
I like to make a couple of comments before I got acquainted with naturopathic medicine in the past, I would say 10 years ago, when I decided that the medicine I was practicing was missing something. And I decided to join the ranks of the integrative medicine group. And then I realized that the current medicine that I was practicing was missing a lot. So we met a lot of naturopathic doctors, and I think integrative medicine is growing in this country. And I'm happy to know that it embraces all areas of previously called alternative medicine. And we have benefit from referring patients to naturopaths, so very much. I think that's a field that's going to grow, and by popular demand, as a matter of fact. The people are ready for this new medicine. They are tired of the old symptom, disease-focused medicine type. Second comment is that the doctor that you mentioned, I think, is called Bezerra de Menezes. He was a doctor that lived in Brazil in the latter part of the 19th century. He was a homeopath, and he is one of the real important individuals in the development of the Spiritist doctrine. Chico Xavier psychographed and incorporated him several times, and other mediums do so. He was a homeopath. I have a couple of questions for you. First is, why did you decide to be a naturopath?
I have this. I'm good.
I have it too.
I'm good. So, why I decided to be a naturopath. I was doing research in chemical oceanography to start with, and I did an experiment for my PhD that I was working under, and I was to grow up a couple of big, huge tanks full of Denaliella, which is a phytoplankton, and then I was supposed to, which takes 2 weeks to grow up. And I was supposed to take the aliquots of that out and varying dilutions, expose it to naughty, nasty things like mercury and PCBs and DDE and DDT. And then I'm supposed to see how long it takes for them to die and measure, a little bit of oxygen levels, the electron transport system, which was his favorite technique, was to do that, and then graph it. So you can imagine that you would have, if this was at the beginning, you'd have a whole bunch, and then they would go down there, depending upon the concentration of the poison and the length of time that they were exposed to it and the strength of the organisms. So I did. I had all these gorgeous curves, going down beautifully. And I thought to myself, I wonder what difference it might make if every day I grew up Denaliella and I went by and told it it was strong and put my hands on the tank and told it that it was healthy. And I thought, I think I'm going to do this all again. So I took out aliquots and I grew up 2 more weeks. I grew up the Denaliella, put my hands every day on it. And I know you're not surprised that the die-off rate, it lasted much, 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 much longer before it started to die off. It was so much longer that I went, no one is taking into account the effect of the experimenter on the experiment, the intention of the experimenter on the experiment, and look at what this huge difference it can make, so that why would I keep doing this? So, because I do follow my intuition, I moved out to about 100 acres with no running water and no electricity, and I lived there for about 1.5 years and learned what it was like to be on this planet more. And I really enjoyed that. And interestingly enough, a number of the naturopathic doctors that I was in school with did the exact same thing. And then I had a dream where I was taken before a very bright being who just looked at me, smiled, and then walked by me, and I walked out, and I woke up in the morning and went, I have to go to naturopathic school. So that's why I went to naturopathic school. I followed, when they tell me something that strong, I do it. I learned that a long time ago. And interestingly enough, I've started asking other naturopathic doctors how they came to this profession. And the group of doctors that was in my class, and the class is a few years around, we were in the late 70s, we started. The doctors, a number of practitioners were dying out. There were very few. And I really feel that it was spirit that led all of us to this medicine, because out of my class comes the leaders of naturopathic medicine that you have probably met. People that started the next schools, were in my class. So many of them have reported some kind of dream or initiatory type event.
Next question. What happens when you intervene at a spirit level to treat a patient?
So I think maybe I can answer this best by giving you an example with homeopathy. And you probably, those of you that have used homeopathy might very well have examples of your own. So a patient came in to me and she had a very uncomfortable urinary tract infection. And she said, help me, as she's standing, jumping up and down in my waiting room, right? Because she expected it to be helped right away. And so I had to ask her a couple questions so I could match the remedy, give her one dose. Within 5 minutes, she didn't have any more symptoms. It was gone. Another patient, I delivered babies for a number of years, probably 25 or so, at home. And one of the births was a very, everything was normal right up until the baby crowned. And then, as you know, when babies first come out, they duck their heads down and then they turn so their head faces the same way that their body is going to come out. Well, this baby turned 3/4 of the way around, and I usually kind of guide the head and just kind of feel it go. I just took my hands off and watched because the head just kept going. So this child it had been like I was turned my head and facing this way, turned this way, all the way around. And so it really twisted neck. So I just took my hands off and then we got the baby out and the baby would take a breath and then not breathe. And then take a breath and not breathe. Only breathe if we kept kind of moving it, you know. And so all of a sudden I remembered learning when I was in school of a story of a chiropractor who had said that sometimes the atlas goes out so much that it affects the nerve and the phrenic nerve, and they can't take a breath. So I just put my fingers on the side of the neck and boom, it just moved because you don't have to do much. And then the baby breathed normally. But there was this moment, this time, when it was pretty distressful for both of us, the birth attendants, and the mother was a nurse. She knew what was going on. We weren't talking, but she knew what was going on. And then the baby was fine and has grown up to be a healthy young man. And the mother, though, we always stay for 2 hours after a birth, and the mother was close to the 2 hours, and we realized that she had a very high fever. And thought, oh my goodness, there's no reason for this. She wasn't sick. I can't believe she has an infection. So what could this be? Well, there is a homeopathic remedy that is for developing a fever after a fright. And so we gave her that remedy, and within 10 minutes or so, the fever was gone. Her temperature was normal. And we were all relieved because then we could go home after that long birth. So that is the kind of thing that can happen.
Homeopathic medicine is pure energy, basically.
Basically it is, exactly.
And the patients that seek your help, they understand the process that you're using? Or they expect the traditional, well, traditionally used to be homeopathic, but the allopathic type of medication?
No, the patients that I see come in and they pretty well expect that they're going to be, all their symptoms are going to be talked about. When I see them, I will take a pretty extensive, history. Because to me it's important to know, how their parents were and the health of their parents and their grandparents, because then I can get a much better idea of things that can move through families that they might not have considered. And I ask them what medications they're taking, if they've had surgeries, if they've lived in places where they could have been exposed to different toxic things, and then what they're there for. And so I will tell them at that point, once I've done all of that, I will tell them that there are a number of approaches that we could take depending upon them. And if we are going to do homeopathy, then I will tell them that it is a more energetic medicine. It won't interfere with any other medicine, but I don't go into great detail about it. And they don't understand that there's, a mental and a physical body, emotional bodies, and that it's going to intervene in those levels. After a while, they might understand that more, because I also taught homeopathic first aid classes to my patients. It became very clear to me that after I got woken up in the middle of the night and small child has got an ear infection, then or a fever, that it would be really in my best interest if they had a kit at home of homeopathic remedies, and I could just say, you need this remedy, and they'd try it. And it really worked out great, because once they started learning just the first aid applications of homeopathic remedies and they had the kit, they became very good at using that kit for their family and their friends. And I think it just overall helped spread that medicine.
Another question is, obviously, I think everyone here knows that our healthcare system has failed us, and it doesn't seem to be going into the right direction, except that the public is actually demanding a change. But the main issue that we see with areas in integrative medicine, including naturopathic medicine, is reimbursement for treatments. And how do you face that, and how?
Well, in Oregon and in Washington, we have insurance coverage for naturopathic
in a few
physicians.
states, yes. I think in Connecticut.
And in Connecticut too, yeah. And we're just really trying to feel out how that's going to work with the new healthcare program, because if you're not included in the group that's going to take care of people, then you aren't going to be covered. And we had a number of clinics, the school had a number of clinics. I think we had 21 clinics throughout the greater Portland area, and they mostly dealt with lower income people. And now those people have all been signed up with the new healthcare program, and the naturopathic medicine is no longer covered in that program, so they can't see us and get reimbursement. There's 2 companies, insurance companies, that started up in Oregon itself that are soliciting naturopathic physicians to be on the panels of that company, so that then those people that have that insurance would go to a naturopathic doctor and get reimbursed. But it's a big difficulty.
You mentioned something about being focused more on homeopathy now, but a lot of or many of the naturopathic doctors that I know are doing quite a bit of detoxification and so on. Tell me a little bit, why did you move toward a less interventional aspect?
Well, I think that when I started out, I realized that detoxification was it. You had to do detoxification. And so I do actually still do IV chelation therapy in my office, and I do IV treatments. I don't have a sauna, but I'll send people out for saunas. And I'll do constitutional hydrotherapy, which is a way to balance the sympathetic and parasympathetic nervous systems, and will help it somehow rights the body. I'm sure some of the researchers here could tell me how. But what we know is that if you just treat someone, say who has a really bad allergy problem, they're allergic to all kinds of environmental allergies, if we just treat them with constitutional hydrotherapy and they do it by themselves in their home every day for like 5 or 6 days, all of a sudden they're not reacting as strongly to their environment because their body is balanced out. I started homeopathy after probably 10 years out. I went and took advanced training for it, and I went to India and studied there too. And that was because I was delivering babies, and it was really hard to get away for this training and the classwork. I don't deliver babies anymore because I moved to Maryland and set up practice here, and in Maryland it was a felony if you delivered a baby outside of the hospital. So it seemed to me like that wasn't a good plan to do that. However, when I did deliver babies, it was the way that Wendy talked about, a conscious birth with as much prenatal education as I could get into the parents. I required that they took my prenatal class so that we would talk about all the kinds of things that Wendy mentioned. And of course, when you're doing a birth, being aware of what's going on in the family dynamics and in the grandparents and what's going on with the baby as it's in utero is really helpful to make sure that gets addressed before the actual birth process itself, because then it will make the birth go much easier. I also noticed that I would use, I would feel things in my body sometimes that I'm not sure if we're going to say this is telepathy or being a medium, but I would feel it in my body and I would know that something was going on at a distance with one of my patients. I wouldn't necessarily know who it was, but this was the days before pagers, so it was very helpful for me to be able to call back and get a message off my answering machine and find out what it was, and then be able to do something about it.
Okay, I think we could open some questions to the public at this time.
If there are any questions from the audience or comments, please step forward and please use the center aisle microphone so that we can capture on the recording. Thank you.
You said that you have physicians, like they have to go through some years in college and medical school and then specialize in naturopathic.
Mm-hmm. Yeah,
Yes.
it's a 4-year postgraduate program. That means you have to take, chemistry and biology and psychology, and most people have a bachelor's degree first, and then you go to medical school.
Oh, okay. Thank you.
Mm-hmm.
First, I want to thank you for sharing those principles with us. That's just so fabulous to see that in print. Something, we all believe in here, but to see that a school follows that. But my question is kind of following on the last presentation, a comment that came up, and that is, how much do you see, what do you think in terms of the population of people and where the resistance might be to moving into this? We're hearing that, the public is demanding it. On the other hand, natural medicine requires, as you said, that the patient take responsibility for their care. So I'm wondering, where do you think more resistance might be, or where the least resistance? Is it from the schools, from the doctors, or from the patients themselves that, they're willing to go forward with this kind of care?
Yeah, it's what I always tell students is if they would please just go practice somewhere where there are not a lot of naturopathic doctors, it would be very, very good for them. They'll have a very full practice. Because all I've ever had to do is tell people what I do. And as soon as I tell them what I do, I have people that want to come and have that kind of treatment. Because most people don't really want to take pills. They would prefer not to have surgery. And so if you can catch things earlier or offer them a different way of being treated, then you might be able to avoid some of those. Now, that's not to say that pharmacological agents are not useful, because they are. It's not to say that surgery isn't oftentimes critical. And thank goodness we have very good surgeons. And I'm just saying that there are also a lot of people that don't need that yet and could go a whole different route and be healthier for it. Now, the resistance comes from, in the people, in the general population, we are inundated with all kinds of advertising telling us you can just take one pill and you'll be well, and just take this one, and if you can't, and now it's to the point where you're getting patients being advertised to directly, go tell your doctor to prescribe this pill for you, because they haven't done a good enough job and done that yet, right? So that's one problem. And another problem is that people just don't like to do work. I always ask patients that. I'll say, how well do you want to get? I mean, do you want to, that if you're allergic to eggs, you're going to have to quit eating eggs. And they don't even want to do the test. They don't want to know. And other people desperately want to know, because they're going to quit eating the eggs. And so I try hard to talk to them beforehand about what we're going to be doing, just to save us both frustration and their money, because they'll have to pay for the test, right?
I want to complement that answer as well. I think one of the main problems that we see nowadays is that our modern medicine is very suitable and was designed to treat infectious disease, acute trauma, and acute illnesses. The fact that in the United States, 75% of the admissions to hospitals are for complications of chronic illnesses, and we're not prepared to treat that. A patient goes to a hospital with symptoms of a chronic illness, and the symptoms are treated, and then they are discharged in their own recognizance. Furthermore, there's a whole industry built around the pharmacological products, surgical products, etc. And that's been okay to advertise that industry to the public, which is probably one of the few countries that this is allowed. Therefore, they're selling a pack of goods that's not real. Patients have become unaccountable. They are demanding that the system cures, takes care of them, so they don't take responsibility. One of the worst things that we have in our office is to advise somebody on a proper nutritional path. It's the hardest thing that they have is to change, to take responsibility for their own health. So when we see professionals such as naturopaths and other non-traditional MDs, and us in our area, trying to make patients accountable for their own health, self-healing, that's what the barriers are. And second, there are barriers with the allopathic physicians as well. They feel competition is strictly that way. They don't refer, they minimize that, and they ignore, but there's only up to an extent that you can ignore what's happening, because that's coming from the basis, from the public.
And naturopathic doctors are really, our training is good at dealing with chronic disease. That's what we do. That's what we're good at. Yep. And I have to say that when I was in Baltimore in practice, I had a lot of referrals from the MD community. And that was because they were pretty delighted when their patient asked for somebody that would guide them in how to eat and nutritional changes, that they could refer them to someone who'd been to a 4-year postgraduate medical school and was licensed at least in some state, because Maryland didn't license at that time. But I kept my license in Oregon and Washington.
Okay, thank you, and thank you for your presentation. About 20 years ago, I went to California to train in flower essence therapy, and I'm just curious how you view that as a self-healing modality, and how widespread do you think people understand and use that?
Well, of course, being in Oregon, I would say it's pretty widespread. I have flower essences in my office. I put together rescue remedy all the time for people and have them take it. I know a lot of physicians are trained utilizing it at the school. It is something that you can use, yourself, on your family and your pets, and pretty safely. And it's an energetic medicine.
Thank you for all this knowledge that you're sharing with us. I would like to know, you talked about all the modalities that are studied in the naturopathic medicine, and I'd like to know how the community of the faculty community that in naturopathic medicine understands the concept of spirit.
Now, the first question is what all the different modalities are that are taught?
No, you told us about all the modalities, right? But
yes.
I am curious to know how they accept the concept of spirit, if all.
It's different with different faculty members, of course, and I don't know them all. However, in the Chinese medicine program, the dean of the school is a Qigong practitioner, and I would say that the concept of spirit and energy work is strong in that school. In the naturopathic part of the school, they do the revival meeting every year with the students, where basically they talk about, we call it that first principle, we call it the viz. So they talk about the viz, which is that energetic component that we call nature that heals all of us.
Are there any other questions or comments from the audience? Okay. Thank you both, Dr. Moore,
Thank
Dr.
you.
Petrillo, very much.